Welcome to the Healthy Heart Show, where we pull back the curtain on conventional medicine and dive into the root causes of cardiovascular health. If you are concerned about high cholesterol, high blood pressure, heart attacks, stroke, or atrial fibrillation, this is the place for you. We will provide natural heart information that will help you prevent, treat, and reverse any ailment, leaving pills and procedures out of the picture. Here are your guides to holistic heart health, board-certified cardiologist and Amazon best-selling author, Dr. Jack Wolfson, and natural heart doctor, naturopathic physician, Dr. Lauren Latanza.
Hello, it's Dr. Jack Wolfson, board-certified cardiologist at Natural Heart Doctor. Welcome to another episode of the Healthy Heart Show, where our focus here is bringing you the best information with the best guests on how to help you achieve your 100-year heart. And today I have a fantastic guest for you to be able to share some information. Dr. Ryan Wohlfert and I are going to be talking about some different topics really pertaining to a lot of his specialty. And just remember, everything that we're talking about, we may not directly link it back to the heart, but understand that everything we're talking about, of course, is linking back to the heart. So Dr. Ryan Wohlfert, welcome to the Healthy Heart Show.
Hey, thanks, Doc. I love being here. And I love your 100-year heart, moniker. I love that. That's beautiful.
Well, again, it's, for most people that I see and that are involved with us, they were told that their longevity is going to be limited. They're going to be on pharmaceuticals, having procedures, decreased life expectation or life expectancy. Somebody with atrial fibrillation, high blood pressure, heart attack, they are told that their life expectancy is shortened. And obviously we want to do better than that. And I know you offer better than that in your chiropractic offices and in the state of Michigan, and you've done some fantastic things. Let me dive right into a little bit of your bio here, okay? So everyone, listen up. Dr. Ryan Wohlfert is a certified chiropractic sports physician and certified chiropractic biophysics physician, using a specific protocol for spinal and postural correction to break free from chronic pain, disease, and organ dysfunction. He's also a certified mindset specialist, helping people retrain the mind-body connection for optimal health and performance. With 20 plus years of education and clinical experience, Dr. Ryan has helped thousands correct their mind and spine to break free from chronic pain, eliminate dependence on a very broken medical system, and make simple pain-free living possible. So Ryan, let me ask you this, Doc, as it pertains to pain, I know that the literature says that people with chronic pain have higher blood pressure, in fact, double the risk of hypertension, undoubtedly have a higher heart attack risk, stroke risk, and probably everything cardiac related. Talk about this whole chronic pain thing.
Well, and that's exactly right. You said at the beginning of this, it might not relate, A to B, but how our body responds to the different stresses that we put on it. In chronic pain, especially you mentioned there with the research, increased high blood pressure and, just overall feelings of malaise and disease. So like with chronic pain, why is that such a big deal? I mean, just in America, not even the world, in America is the number one leading cause of long-term disability, meaning you can't do anything or you can't work, you can't enjoy your life. But in the world, it's like 1.5 billion people. It's about 20% of the world's population are living with chronic pain. And you mentioned right there how it affects the heart and circulation and the circulatory system. So why, let me explain for people who don't understand what chronic pain is. Because if you have,
I was gonna say exactly. Let's break down exactly what that really means. When we talk about pain, what does that mean? And then how do we determine whether or not it's chronic or acute?
Exactly. Because I was thinking today is, if you are in chronic pain, you know what I'm talking about. But if you're not, you're like, so what does that mean? So it could be, headaches, migraines. I mean, those are the things that I suffered with when I was even like 13 years old. Headaches, migraines, back pain is the most common one, I would say, fibromyalgia, arthritis, post-surgical pain that, you had surgery for to try to fix the source of the pain, and yet you still have it. You have it, for months and months on end. Typically, if you go by the definition, it's at least 3 months, but even like 6 months, 9 months, 12 months, at least 6 months that we're talking about, to where and there's different on the spectrum, there's different ranges of, like, if we're talking on a like pain scale. All right. In our office, we ask on a scale from 0 to 10, how would you rate the pain? And 10 is debilitating. So anywhere like 8, 9, 10, those are like severe debilitating. And then you could have, like, for chronic pain, like 4, 5, and 6 is moderate, but it's bothersome. You're affecting your life. You're taking medications for it. You're taking, either over the counter, or you're taking some sort of prescription medication. And the sad part is that still the main method that people use is medications to try to deal with these things. But you and I both know that is definitely more short-term, and long-term, especially for the organs and your heart, it causes them to break down faster. If we're just talking about like NSAIDs, in like musculoskeletal health, I mean, that's been shown to break down the joints. If you keep taking those over and over again, break down the joints on top of what it's going to happen to, the gut, messing that up. And also there's been studies showing how that can lead to atrial fibrillation, an increase in the risk of atrial fibrillation. So that's why it's such a big problem, and how it can be related to your overall health.
Yeah, it's people, again, in chronic pain, it almost seems like it's, again, and you said it initially in the beginning about the tens of millions or hundreds of millions in the US and billions around the world who suffer, and they swallow ibuprofen and Tylenol like it's candy, like they're swallowing M&Ms, and the detrimental effect on that, what it does to liver, what it does to kidneys, what it does to the gastrointestinal tract, and increased risk of ulcerations, what it does to blood pressure, AFib, so on and so forth. And I think we'll both agree, and because me, I'm an extremely anti-pharmaceutical guy, as I know you are as well. There's a time and a place for acute pain management. We should not let people suffer in pain. Please, if you're out there, again, we need to do what we can to get you through the acute pain. And, listen, are there natural remedies? Yeah, we can talk about natural remedies. Are there pharmaceuticals? We can talk about pharmaceuticals. But again, for the chronic pain, this is where we need experts like you, Dr. Ryan, to be able to get people through this chronic pain, because, the pharmaceuticals are absolutely deadly. And then, of course, the stress of the pain and all the other catecholamines and cortisol, what that does to the rest of the body, it's a problem.
And I like how you said it. It's for the acute, right? The medications are over the counter for the NSAIDs, Tylenol, ibuprofen. But my whole point of it is, and I think yours is too, is we depend too much on that, or we think it's going to actually fix the problem, to where it's masking the symptom of the pain, whether it's a headache, whether it's back or neck pain, knee pain, hip pain, whether we take it too much before or after surgery. And, it's funny because according to the Journal of Pain Research, 75% of low back surgeries to alleviate back pain fail. And on top of that, what's even more alarming, I think, is even though they were taking these opioids, medications before the surgery, thinking, okay, I'm going to get the surgery, now I won't have to take those drugs, they're on them after the surgery as well. So yes, we want to help get you through the rough time, but not depend on that for the rest of your life. That's why, I know your wife's a chiropractor and I'm a chiropractor, and we've heard this all of our careers is once you go to the chiropractor, you're going to have to keep going back, which I think is just unbelievably great marketing by whoever started marketing that from like the traditional medical system, because how often is somebody on a heart medication that they say, well, you only have to take it for a short period of time, you'll eventually get off of it. So it's hypocritical, which is one of my least favorite traits, to say that's what you'll have to do. If you go to get adjusted once, you're going to have to keep going. Well, obviously, I know your wife is a big proponent of getting adjusted. My thing is, once you see what it does for you, and we're just talking about that in general, this could be for eating healthy. This could be for losing weight, moving. Once you feel how good that is and what you can do because you're doing that, you're going to want to keep, at least I hope, you're going to want to keep doing that. Chronic pain, it's one of those things where pain is a good motivator for people to change something in their lifestyle. And, I don't like people being in pain, but if it spurs them to make a change, it's not the worst thing in the world.
Yeah, no, that's all great stuff. And in fact, my entire family, we're going to the chiropractor today. You and I are talking. It's a Wednesday, and we go on Wednesday afternoons to our local chiropractor, and the whole family gets adjusted, from myself, Heather, everybody on the list you see up there, even all the way down to the baby. We all get adjusted. And I think it's really for our family, it's kind of like it's the best day, because again, we walk out of there feeling so good and so refreshed and vitalized. All right, so what happens? So I make an appointment with you, Dr. Ryan, and I come into the office, and again, you take a history from me, but I'm there, and let's just say it's for to be cliche with chiropractors. Let's say it's for back pain or headache. Kind of, walk me through how working with you and some of your certifications of what you do help me with my pain.
What we do, and you mentioned that in the introduction to bio, is, I'm certified as a chiropractic sports physician, but even more, or even as important, as a chiropractic BioPhysics, CBP, we'll call it for short. And that's what it's called for short. And that's a specific corrective technique of the spine. So what we do in our office, and then even helping people virtually, is there's one point of this that I might not be able to do virtually, but refer somebody where they are, is, you're right, we do a full history and consult, not just of the pain, but how are your organs functioning? How are you breathing? How are you, are you short of breath? You can have them fill out the a complete health history. We do an exam, a postural, a physical, biomechanical, neurological exam to find out where your posture might be off, because your posture, it's a window to the spine and nervous system. And with CBP technique, we also take standing spinal x-rays, full spine standing x-rays, because of how we know the spine is directly correlated to everything in your body, because of what it protects is the spinal cord, which is an extension of the brain, right? So what happens is, through different types of stresses, whether it's physical, chemical, mental type stresses, emotional stresses, these, our posture, our spine can get out of alignment. It can get distorted. And like I said, the posture, it's a window to the spine. So anywhere that your posture is, distorted, off, imbalanced, means that somewhere where the nervous system is getting shut down. And it's also a window to the nervous system because it shows what the spine is. So one of the things that we do that's unique is, on top of taking these standing spinal postural x-rays, because your spine should have a specific shape to it, just like there's average and normal ideal for blood pressure, for A1C, for hormone levels. It's the same thing for the spine. So with the spinal alignment, how ideal, or what's ideal is, and this is what the x-rays will show, posture isn't always definitive. That's why we want to see what the spine looks like on the inside. So from the front, we want it straight up and down, right? Just like a building, we don't want anything shifted to the side to side, bent down one way or the other. Now, from the side view, we want 3 curves of the spine, 3 equal counterbalanced curves, 1 in the neck, 1 in the mid back, and 1 in the low back. And we'll get into we'll stay away from the sacrum and pelvis, but there's another one so these are balanced, and typically 35 to 40 degrees. That's what we want each of those to be. And when those get hyperkyphotic, so for example, your thoracic spine, if it gets too much kyphosis, too much of that slouch posture, that can cause the head and neck to go forward. And this can be irrespective of that too, because one of the most common things that we see is forward head posture. But where is that coming from? You could come in with low back pain. And if we don't look at the entire body, entire spine, like the pelvis from feet all the way up to head, and we just focus on that symptom of low back pain, we could be missing what is causing it, which could be 60% of your mass, and my mass is up here in the rib cage, houses the organs, houses the heart, houses the lungs. So if we are in this position, it's going to put chronic strain on the low back, can put chronic strain on the upper back and neck. So we have to look at all portions of that. And if we get it, we've seen this before, right? Doc Jack, our kids were on all the time about it. Patients looking out in the community, people walking there, holding their cell phones down in their lap and creating this dysfunction. I see kids with it, and it's disheartening for me, and it's sad. And so our job is to find out and assess what your spine looks like, what your average and ideal is, because there's a range depending on the shape of different things. Again, I don't want to get too specific into that. And then we bring you back and we take these x-rays, we do the exam, we bring you back and show you exactly what's causing, what your posture looks like, what your spine looks like, how it's related to the symptoms that you're having, whether it's biomechanics, whether it's neurologically causing irritation on the nerve roots or nerves or spinal cord, whether it's, even causing, obviously we're talking about chronic pain, how it's creating that chronic stress and strain on different areas of your body, whether that's knee pain, whether that's foot pain. All these things are related. So that's typically that first visit when people come in, up into that second visit where we show people and actually explain why they have the symptoms that they do, whether that's the pain, whether that's, even the heart not working, functionally, why, we all know about Christopher Reeves, right? And I love this example of how the spine and nervous system is directly related to organ health, because he broke C1, which hurt. Again, it didn't sever the spinal cord up there, but what it did, as well as I do, it dented the spinal cord right up here. His heart did not function fully, right? He had a defibrillator, he had a pacemaker. His lungs didn't work and function optimally. He had to have a ventilator. His gut, his intestines didn't work. They had to push on his stomach, so his gut area, for him to go to the bathroom. And I say that for this reason. It gives you a picture of how, and I think a very powerful example of how the spine and nervous system is directly related to organ health, because he didn't fall and injure the organs. He injured right up there in the upper part of the neck and the brainstem area.
The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor. Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology Coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com. Now back to the Healthy Heart Show.
Yeah, no, that is a great example. And you've really talked about this quite well, as far as really as you're talking, what I think about is the typical patient experience when they go to their medical doctor. So they go in with low back pain, and you just described that you've got this extensive intake to really be able to get to the root cause of the problem, and how you do the physical examination, including specific neurologic examination, and then how you get into x-rays and things that you use in this whole assessment, as opposed to when they go to their standard medical doctor. The medical doctor, at least when I was kind of doing this in my internal medicine training, would have been, okay, I've got just a short time with this person to be able to come up with a diagnosis and come up with my therapy. So we can say, okay, acute back pain, and here's my treatment, right? It's ibuprofen, maybe it's a Medrol dose pack of steroids, maybe it's just Tylenol. And then I think that we haven't really answered this or talked about this in previous podcasts. The typical medical doctor, certainly many do refer to chiropractors. Let's get that straight. Many medical doctors do refer to chiropractors. But I think their go-to may be, hey, I'm going to refer out to physical therapy. So tell me about the patient journey in your office versus a physical therapist, if you will.
It's very similar. And I think what I'll say about this, about, medical doctors referring to chiropractors, I think we got to do a better job of reaching out to medical doctors for those referrals, for that interaction, for that engagement, just because it's been years and years and years, but still they're not really understand what we do. So if we do get a referral, right, or I'm talking to everybody out there, if chiropractors are listening, make sure that you ask to send a report to their doctor to create that relationship. So I just wanted to add that in there. So how it's a little bit different, it's kind of ironic. We're going to actually be adding physical therapy into our office really shortly, Jack, and it's going to be amazing because it's going to be a perfect mesh of spinal care and also these principles of CBP, again, chiropractic biophysics, because what we do that's unique and different is we do specific postural exercises, mirror image exercises. So I do love general physical therapy exercises, but I also like specificity, especially for somebody's posture. So like, for example, in physical therapy, a lot of times what can happen is they might do it the same on both sides. Like if they're doing posterior flies or like rear flies, shoulder exercises, and you might do it the same on each side of the body in the same direction. But if your posture is, again, we've talked about that slump posture before. If your body, if you're watching this, I have a nice long neck so I can get into different positions. If you look at your head and neck and your nose is on the opposite side, you see how my neck is now shifted over to the side. We don't want to be doing exercises in that direction. We want to do specific exercises, and that's what we show people how to do, going in the other direction to strengthen and mold the ligaments and muscles to help straighten that out. So that's exercise wise. Now, another unique part of what we do is called postural and spinal traction. And you might be seeing this before where it's, straight axial traction is pulling it straight up. And that's great for symptomatic care, but to reform these curves in your spine that I spoke about, like the kyphosis, if it's too excessive, an adjustment by itself or standard physical therapy exercises of just, maybe pulling your shoulders back, taking your head back, it might not get that into the correct curve position. So by that, I mean, we have to do specific forms of traction, just like an orthodontist has to, or I should say similar to, an orthodontist has to put on crooked teeth to straighten those out. You can't just push on crooked teeth or do exercises, till you're blue in the face for your teeth. You have to put braces on them. So that's similar to the traction that we do for the spine. And I always tell patients, the good news is, unlike how you have to wear braces 24 hours, 7 days a week, you have to do these specific exercises and traction about 15 to 20 minutes a day. And then go into, like, again, a retainer phase for the teeth, similar, doing these exercises proactively, even after your spine, your pain has been corrected. So that's a little bit about the difference there. But otherwise, I love exercise, both general and specific exercises that physical therapists do.
What now? I know also, obviously, that you're a certified mindset specialist. Tell me exactly what is that certification like? Mindset obviously is something that we never learn about in medical school, residency, fellowship. We never talked about mindset. Certainly, mindset brings to me is kind of like kind of the emotional wellness side of things, and knowing that people with anger, anxiety, stress, depression, social isolation, which of course is at an all-time high right now, all those are linked to cardiovascular disease. Chapter 5 of my book is called One Nation Under Prozac, about how the answer is not Prozac. We have to identify that people have these issues. But, again, tell me about, the mindset certification and really how that plays into the whole pain model.
Oh man, that's great. I do want to go back and hit on one thing, because you reminded me of this. Again, a lot of people, the 100-year heart, right? How does this posture and physical part of your body affect your heart? Well, I love this one quote from Rene Callier. He's one of the pioneering MDs, physicians in physical medicine and rehab. He said this: to live a long, active, energetic life, few things matter more than good posture. And this next one, which I think relates to the heart even more, is posture affects, he didn't say this one, but this is from the American Journal of Preventive Medicine. Posture affects and moderates every physiologic function, from breathing to hormone production, spinal pain, headache, mood, blood pressure, pulse, lung capacity are all among the functions most easily influenced by your posture. And just logically, I like taking people through this. If you are in this most common hunched over posture, your head is forward, and you try to take a deep breath in and out, one, it's not as fluid, it's not as easy as you sitting up straight and doing it. And you guys can try that at home. On top of that, just in this position, remember what we talked about. What is inside the chest here? In that thoracic spine level? That's the lungs, that's the heart. So now you're causing the heart to work harder, just trying to function, your lungs as well. So I just wanted to go back and really set that in for the listeners to understand, like, okay, that is pretty much a direct correlation right there of how our body is responding to the posture that we're in. So we want to watch out with how long we're in that posture. Now, with mindset in the brain, mindset, you're right, it's the emotional and mental part of the game. And, mindset, a definition of it is essentially, how do you see the world? How do you see yourself? Getting to know yourself and the mindset you take into things. You can either have a fixed mindset or, well, there's a spectrum there as well. Fixed mindset where you think nothing's going to get better. You're going to be in pain for the rest of your life. My dad had arthritis. My dad had high blood pressure. He had a heart attack, so therefore I will. That type of thing, those seeds, actually, that's not even a seed, that weed of a thought that gets in your brain and that gets reinforced, gets reinforced over and over again, has a huge part in what we are doing physically for our body as well. Because if we go into it in our unconscious mind, thinking, okay, it doesn't matter what I do, I'm still going to have this. I'm still not going to be healthy. I'm still going to be sick. My heart's going to give out. I'm not going to be able to live to 100 years old. If we go into a situation like that, that affects, and this has been shown in different surveys too, what people do action-wise. So we can take all the action we want, which is great, and I encourage that. But I've seen this many, many times before, I'm sure you have too, where people lose weight, but then they gain it right back, because that's not who they identify themselves at, because of these weeds that have been growing inside their mind. So to retrain somebody's brain, their mind and body to help lead them towards health and performance, we have to, like, two things that I'll hit on right here. We have to learn what we're saying to ourselves. So in this EYL certification, it's called Eliminate Your Limits. There's 4 pillars: learn your language, count your wins, review your direction, and imagine your outcome. I want to just talk about the first 2, learn your language and count your wins. So learn your language is just, what are you saying to yourself? What are the thoughts that, are holding you back? What are you thinking on a day-to-day basis? Whether it's about your health, whether it's about your relationships, whether it's about your, career, because all those things, they can create stress if left untended. They'll continue to grow. And when weeds start to grow, they get more weeds. There's more weeds there instead of the flowers blooming, instead of the grass growing, the green grass. So a great way to identify in what you are saying to yourself is just throughout the day, or even at the beginning of the day, ask yourself, okay, what am I thinking? Or what are the thoughts that are running through my head? And just identifying them just to start off with. What am I saying about my health? How am I behaving? Even that can be a stress to our brain and our body that's filling up our stress bucket, our threat bucket. And our brain can only take so much of that before it creates a symptom like chronic pain, like high blood pressure. And that's how our brain gets the body's attention to do something about it. So again, symptoms aren't a bad thing. It gives us information. So with learning your language, it's merely becoming more aware of what your thoughts are, how you're feeling physically, how you're feeling emotionally, and even how you're behaving. Those are like the big four. What am I thinking? What am I feeling? How am I feeling emotionally? And then what am I doing? And just taking inventory and writing down what those are instead of them swimming around in your head. Now, I like to counteract that because that's deconstructing our mindset. That's finding out, how do we perceive ourselves, and how can that lead to disease? How can it lead to, like unserving nature and unserving behaviors? So I like to count your wins, or another way I put it is find the evidence. Count your wins is not just gratitude. Counting your wins is actually finding the evidence day after day consistently of not the big aha moments, not these big breakthroughs that you've had, but the little things that you're doing day after day to lead you towards that 100-year heart. So did I have a nice green salad today? Guess what? That's a win. Did I try a new vegetable today? Doesn't matter if you ate it or if you liked it, you tried it. It means, okay, did I go for a walk instead of sitting down after dinner? Those are all like these little things that we take for granted. And why I say it's not like an affirmation or gratitude, it's because it actually happened. You actually did it. So there's evidence right there, where if we don't have that evidence, sometimes we question whether, we really did it. And we're trying to convince ourselves of something maybe our unconscious mind, our unconscious brain doesn't actually believe. Because if you've always been overweight, or you've always struggled with your weight, and you say, I am healthy, or I am at my ideal weight, like an affirmation does, there's this cognitive dissonance in the brain where it's like, you can say it all you want, but your brain is not going to believe it, and you're not going to take that action towards actually getting there. And then with gratitude, I'm a big fan of gratitude, but gratitude, I think, requires more emotion, right? It needs that emotional connection for it to really sink in. And for me, I'm just telling my personal experience. Sometimes, I'm grateful for a nice cup of coffee, but it doesn't bring me to emotion, right? So that's why counting your wins is so powerful, because we don't have to put all this weight on, like, oh my God, am I doing it right? I'm not feeling the gratitude, but you know what? I did it. And it's the consistency with which we write down those. And I'm a big fan of writing them down, because that seals it in with the brain too, because your brain is not only thinking it, it's writing it down, and then you're seeing it. So you get 3 repetitions of it. So that's 2 good action steps for people to take, especially if you're down in the dumps, if you're stressed out, counting the wins, no matter how small that they are.
Yeah, I love that. We're doing this Happy Heart Month program, and that's kind of the assignment that we ask people to do every day, is to come up with 3 things you're grateful for, but then also these tasks that we have throughout the month that, again, are those wins. And if you've done this, right, those are the wins. So again, if you've gone to the chiropractor at least once during the month, that's a win. If you are, eating seafood, 2 times a week, that's a win. I mean, all these different things that we target for heart health, to make sure that people are getting those wins. Tell us, again, Dr. Ryan, there's so much fantastic information and stuff that you're doing to be able to help people. It just makes me so excited about the fact that I married a chiropractor. Most of my friends are chiropractors. I'm going to the chiropractor today with the family, as we said. Tell us more about how people can find out. I know, your website, totalhealthspine.com, encompasses kind of like your local offices in Michigan, but then also how to work with you guys virtually and some other programs you guys have. So tell us more about that, how people can find and work with you guys.
Well, what I would love for people to do is I'm actually holding and hosting a chronic pain masterclass. So chronicpainmasterclass.com. And that it's going to be a live 3-day event where I'm actually going to meld with 6 other experts, the science and application of, it's basically a literal how-to, like what to do to get out of chronic pain that you're not getting. I mean, it's the first time I've seen it put together. I know you and I, Doc, have been part of a lot of summits, a lot of master classes, docu-series. This is the first one I can remember. Like I'm actually showing people how to do it. Like, here's like, this is what I want you to do. You're going to walk away from it with an actual practical, I don't want to say practical steps, but an actual guide and roadmap with your mindset in how to do that, with your sleep, with your nutrition and detoxification. A good friend of ours, Dr. Elena, she's going to be our expert with that. We're going to do mindset journaling. We're going to, in the spinal aspect of it too, movement. So these 6 experts, we're putting together this roadmap of how to do this. And I encourage you to go to chronicpainmasterclass.com because that's where it's going to be. You can get all the information from it. You can get 50% off the live portion of it. And another cool part, you can participate in the different exercises that we're going to be doing, both physically and mentally. And then also there's going to be a Q&A right then with the expert. So you can ask them specific questions about you and what they presented. So I would love for people to check that out because I mean, I'm really excited about it. The more I'm learning what our experts are going to present.
Yeah, I know this is wonderful. chronicpainmasterclass.com. We'll make sure we put that in the show notes. And when we email about this 3-day event, like you said yourself, Dr. Elena Villanueva, other experts, this is wonderful. So fantastic. Again, listen, for those of you who are out there, again, there are a lot of people listening, a lot of people suffering with pain, a lot of people with pain and cardiovascular disease, and they are intimately linked, unfortunately. So we got to fix one to support the other. We got to take care of the pain. So again, Dr. Ryan Wohlfert, just sincerely appreciate you being on this episode of the Healthy Heart Show. And again, I applaud you and your wife and your team over there in Michigan for everything that you guys are doing.
Thanks, Doc. Thanks for having me.
You got it, my friend. All right, Dr. Jack Wolfson, wrapping up another episode of the Healthy Heart Show. We will see you next time with another fantastic guest. And again, our goal here is your 100-year heart. Stay with us, and we're all going to get there. Be well.
That does it for today's episode. Thanks so much for listening to the Healthy Heart Show. Please help us get the word out by liking and subscribing to our podcast and our Facebook page, Natural Heart Doctor. Please show support for our podcast sponsor, Cardiology Coffee, your resource for organic, antioxidant-rich, mold and pesticide-free coffee shipped straight to your door. Learn more by adding @cardiologycoffee on Instagram and visiting cardiologycoffee.com. This podcast provides materials for information and educational purposes only and should not be considered medical advice. We encourage you to contact your physician for any of the health issues discussed here.